Good day, everyone. My name is Rainjan Sairi Argota from BSN2 12G, and today I am going to perform the catheterization of a female. So the first thing that we are gonna do is we are gonna check the doctor's order for catheterization. So the rationale for that is to promote procedure accuracy. For the next thing that we are gonna do is we are gonna wash our hands before preparing the sets that we are gonna use for the procedure. So the rationale for that is to deter the spread of microorganisms and to prevent contamination for our materials. So there's for the next step that we are gonna do is we are gonna identify the patient and explain the procedure that we are gonna do. So the rationale for that is to rendering the right care to the right patient. And lastly, we are gonna provide the privacy by screening or closing the door. So to start our procedure, the first thing that we are gonna do is we are gonna greet our client politely, introduce yourself, and ask for the client's name, birthday, and ask for the client's comfortability in the setting, and also give the chance to the clients to ask questions and to know about the procedure that you are gonna do. Hello, good day. My name is Rain, and I am your student nurse for today, ma'am. Ma'am, may I know your name? Oh, Miss Nai. Okay, Miss Nai. When is your birthday? Okay, may I see your wristband? Okay, thank you, Miss Nai. Okay, Miss Nai, are you comfortable with the setting right now? Is the temperature okay? Okay, so Miss Nai, I'll close the door and the window so that we will secure your your privacy. Okay, and Miss Nai, do you have any questions? Okay, thank you for that, Miss Nai. So after that, we are gonna start the procedure. Provide the privacy by screening the closing the door, the room, and the position patient in the dorsal recumbent with the flex knees. So, ma'am, I will now start the procedure. Okay. So, drape the patient, exposing only the area that we are gonna use. Do not worry, ma'am, because I will be just exposing the area that we are gonna lead the procedure. Okay. Are you okay, ma'am? Okay, thank you. Okay, so apply the direct light to visualization of the genital area. So the rationale for that is for proper visualization of the area being examined. So next is thing that we are gonna do before we are gonna use our sterile forceps to cleanse the area using the cotton ball with betadine is that we are gonna put on our gloves. So the rationale for this is to protect ourselves from any discharges that is coming from our patient. Okay, please do make sure that when you apply your gloves, it is in a proper spaces. Okay, and make sure that you don't want to touch any place outside of it. So now we are gonna use our sterile forceps to cleanse the area using the cotton balls with betadine. So the rationale for this is to minimize the risk of urinary tract infection by removing surface pathogens. So I have the betadines here that are sterile, and we are gonna clean the area. And discard another and discard. Okay, so I'm just gonna clean it up. So my gloves are now unsterile, so I'm going to remove my gloves and apply another gloves to perform the catheterization. Okay. And we are gonna dispose our gloves properly. The next step that we are gonna do is we're gonna open the set, observing the sterile technique, and we're gonna put another gloves. Okay. We're gonna identify the right cuff and the left cuff, and by using the thumb of our edge fingers, we're gonna apply our gloves first in our dominant hand. Make sure that you don't want to touch any parts of the gloves because the gloves is a sterile. Okay, just roll it up, and on the other hand, so the rationale for this is to keep your safe from any discharge coming from the patient. The next thing that we're gonna do is we're gonna put the eye sheet. So the rationale is to drape the other part of the urinary meatus. Okay, this is the right. Okay, so the next thing, once the eye sheet is being put onto our client, we are now going to lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. So the rationale for this is to reduce friction and irritation when the catheter is being inserted to our client. Okay. So now we are gonna pick up the catheter for at least 3 inches for the tip of the thumb. So place the thumb on the finger of the left hand between the labia minora. Okay? And the rationale for that is to straighten the urethra and facilitate the insertion. So the next thing that we're gonna do is we're gonna insert the catheter into the meatus for 2 to 3 inches or until the urine begins to flow. Ma'am, Nanay, I will now insert the catheter, okay? Nanay, are you feeling alright? Okay, that's good to know. So the first thing, the rationale for that is to relax the sphincter in order to facilitate the insertion of the catheter. So if the specimen is being collected, pinch the catheter with the thumb of the finger while placing the specimen container in the position. Okay, so the rationale for that is so that the urine doesn't leak out. Okay, so the next thing that we are gonna do is we do press the head in the pubis area while holding the catheter in a place, prevent pulling and pushing of the catheter. Okay. So connect the catheter to the urine bag. So I will now get my urine bag. Okay. So the rationale for this is to allow the bladder to drain freely by gravity. So inflate the balloon to 10 to 15 cc of a sterile water using a 15 to 20 cc syringe. I have my syringe now. And I will get my sterile water. So the next thing that we're gonna do is we're gonna insert our sterile water. Okay, done. So secure the Edwelling catheter by taping it into the patient's thigh. Okay, allow sunblock for tubing to accommodate the patient's movement. So the rationale for this is to eliminate the catheter from being removed. And okay. So after doing that, place the patient in the comfortable position. So the rationale for that is to promote the patient comfortability. Okay. Ma'am, I am now done with the procedure that we are gonna place the patient comfortably. So ma'am, I am now done with the procedure. So I will now remove this one, okay, and I will just these things. Okay. Ma'am, I am now done with the procedure, and thank you for your cooperation, ma'am. So after doing the catheterization for the female, we are gonna do the aftercare procedure, in where we are gonna tell our client that we are done with the procedure, and then we are gonna get our things that we have used during the assessment, and dispose those things that are not that needed, and also return those materials and sterilize it. Okay, so that next thing that we're gonna do is we're gonna document the time that we have spent during the assessment, and also we're gonna document the amount of color and initial output of our patient. So the rationale for that is for us to prevent the contamination, and also to give the proper documentation and proper handover of endorsement to our patient. Again, my name is Rainjan Sairi Argota from BSN2 12G, and that's all for today. Thank you.